How are you doing today? Good. So, are you here for an eye exam, I'm assuming? Perfect. So, if you could just confirm your full name, date of birth and address for me, please. Brilliant. Okay, so what we're going to do today is I'm just going to start off by asking you a few simple questions about your eye history, any medical problems and stuff like that. So is that okay? Okay, so are you having any eye problems right now? Okay. Have you had any in the past? Do you wear glasses or contacts now? Have you had any health problems in recent years? Okay. Are you taking any medications at the moment? Right. Are you allergic to anything, whether it be food or anything at all? Yes, I have crazy hay fever at the moment, so I know how you feel. Have you ever had any eye surgery? And is there any eye problems in the family, such as glaucoma? So, do you or anyone in your family have diabetes? High blood pressure? Heart disease? And is there anything else that I should know about? Brilliant. So that is the questions done for today. We're just going to jump straight in now, okay? What I'm going to do is I'm just going to pop some gloves on, just to protect both of us. So these ones are a little bit tricky. There we go. So that's one. Yep. And two. Okay, so first things first, if it's okay with you, I'm just going to pop an eye drop in each eye. This is simply because we're going to be doing a lot of movements and I'm going to be flashing a light in your eye and stuff, so your eyes can tend to get a little bit dry and that may affect the results we have today. So just gives you that moisture and makes that moisture be locked in. So okay, don't worry, this is no chemicals or anything, it's literally just a kind of moisturising cleaning solution. Okay, so we're just gonna get a bit on here. So what I want you to do is I'm just gonna touch here and I want you to look up for me. That's one. Same in the other side. Look up for me. There we go. I'll put one more in this eye because I did two in that one, so look up. Perfect. I'll just let you get used to that for a second. And while you're doing that, I'm just going to take a look at your eyes, just anything visual stands out to me, any redness, any twitching or abnormal blinking or anything. Obviously you have water in your eye, so I will take that into account. No, I think everything looks perfect. So just let me know when you're ready to go and we'll start the exam. Yeah, you ready? Brilliant. So, first things first, we're just going to start off with some simple finger exams, okay? So, I want you to stare straight at my nose for me. I'm going to pop my fingers together like this and I'm going to start moving them out. All you need to do is let me know when you can no longer see my fingers, okay? Okay. So let's go, okay? Brilliant. Brilliant. Take them this way. Brilliant. And out. Okay. Out this way. Okay. This way. Brilliant. That all seems fine there. I'm now going to do the same, but it's going to be the opposite. So again, stare at my nose and I'm going to bring them in. I just want you to let me know when you can see them, okay? I'll come back a little bit. Okay. 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 Brilliant. That all seems fine. Another one again, if you can stare at my nose once again, I'm going to hold my fingers up like this and I'm going to wiggle one, okay? I just want you to say now or yes when you see one of them moving, okay? So stare straight at my nose again. Good. I'll make it a little bit easier for you. Good. Good. Brilliant. Good. Good, 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 good. 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 Okay. Once again, you got all of them perfect. So I'm just going to make a note. Okay, so what we're going to do now is I'm going to be using my pen like now, okay? So this may take a couple seconds for you to get used to it, but it shouldn't be uncomfortable. So if at any part this is hurting you too much, as I said, it really shouldn't, but just let me know and we can stop, okay? So first things first, you can just look here or at me. I'm just going to be moving the light around. You don't need to follow it. I'm just going to see how your eyes react to the light, okay? So I'm just looking at your pupils and anything I can see there. Okay. You're doing really, really well. Okay. Sorry, I know it is just a tad bright sometimes, but this has got to be done just so we can check you out properly. What I'm going to do now is I'm going to ask you to look up for me. Okay, and look left. And look right. And look down for me. Same again on this side. Look up for me. Look left. Look right. I'm just going to get the top and look down. Okay, brilliant. Same thing again, but this time I want you to follow the light, okay? So anywhere the light goes, just follow it with your eyes. Keep your head still, just use your eyes to follow it. Sorry about the traffic noise, by the way. I hope it's not distracting you too much. There's not much we can do, so you're doing so well. Okay, is any of this really, causing you extreme discomfort? Good. I'm going to cover one eye now, okay? Just look anywhere behind me. Look at the chart again if you want. Okay, same again with this eye. Okay, you're doing so well. Again, I'm just going to take any notes down, but you have done brilliant, so absolutely nothing to worry about. No issue. Followed well. Okay. I'm just going to do that last test I did, but without the light. So I'm going to cover this eye, and I want you to just stare at this for me. And then I'm going to uncover. And one more time. Stare at this. Okay. Same again, you can just stare at me if you want. Cover this one. And one more time. Okay, that's brilliant. So, I'm just going to test your colour vision now, okay? So I've got some pen tips, okay? I'm going to hold them up, and all you literally need to do is tell me the colours, okay? So this one for me. Orange. This one. Brilliant. This one. Okay. And what colour is this one? Right. What colour is this one? And could you tell me what colour this one is? You're right, it matches my lipstick. And could you tell me this colour? Brilliant. Obviously we don't expect anything to be wrong there because colourblind is kind of different to seeing the opposite colour. But we do just have to check that you can identify the colours, okay? So one last quick one. Is the left one lighter or darker than the right? Perfect. And is the left one lighter or darker than the right? Brilliant. Yeah. So colours is, again, another 10 out of 10 there. Okay, so we're now going to move on to this eye chart here, okay? So are you comfortable where you're sitting? Okay, what I'm going to do is I'm just going to point at different letters. I just want you to read out the ones I point at, okay? And then we're going to cover an eye, and yeah. So let's start nice and easy, which pretty much everyone can read. So, this letter, please. Good. We'll do line 2. Good. C. Good. L, P, E, D. Perfect. If you could just cover one eye for me, any eye will be fine. I'm going to point at some random one. This one. This one. This one. This one. This one. Okay, and can you cover the other one for me? Nice and easy. C, D. Okay, that is perfect. What we're going to do is we're going to go a little bit more challenging, but don't worry if you can't read. Okay, so this line right here, this is the 20/20 vision. This is a good eyesight, okay? This is what we want to aim for. So if you could read this whole line out for me. D, E, F, B, O, D. That's great. And can you read this number for me? Great. So we're going to give this line a go now. C, D. Great. And do you think you could give this second to last line a little go for me, please? That's okay. Yeah, perfect. And if we want to really challenge ourselves, just read any letters you can see off there, but honestly, it's absolutely fine if you can't. Good job. So, once again, you did absolutely fantastic there. So, yeah, I think that is all of our tests for today done. I'm going to take these off now. So yeah, you did absolutely perfect on the chart. You did perfect following and with the light, and you got all of the colours perfect. So there's absolutely no issue with your eyes. Do you have anything else you would like to talk to me about or ask me today? No? Well, I'll get you a copy of my notes just so you can keep them should you need them for anything, and yeah, so you can grab them from reception. I will file them over to her now, and yeah, it was so lovely to see you today. Thank you so much for coming in, and we'll see you in 2 years if we don't need to be booked in before that for anything. Okay, lovely, nice to see you too. Bye.